Infection organism normally present on the body surface. Bacteria, parasites, friedlanders, bacilli, organism involving tissue from environment. Clostridium diphtheria, Clostridium tetani, organism from both the body and environment. Clostridium bellici, coliform bacilli, Staphylococci, Streptococci. Classification according to the time of entry of organism. Primary infection is caused by organism which are carried out into the wound at the time of injury, example from clothing, dirt, skin, etc. Secondary infection is caused by organism which invade the wound after injury, airborne droplet infection, contaminated dressing, surgery. According to distance and infected organs from the site of trauma, direct infection, infected area or organ lies directly underneath the site of injury. Types direct due to direct result from trauma, fracture of anterior cranial fossa, communicate with the ear sinus infection, gunshot wound, stab wound, etc. Local infection due to indirect result of trauma, mechanism trauma, lessening of local resistance, dead tissue and extravasate blood, providing the favorable environment for bacterial growth. Infection example fracture bone, contusion, a traumatic infection of kidney, liver, spleen, formation of abscess around remote infection, infected area or organ lies away from the site of injury. Types are due to direct result of trauma, criminal abortion, uterine infection, direct infection, meningitis, remote infection. Trauma at an already infected site, a spreading infection, pre-existing staphylococcal lesion of bone, blood trauma, pyemia, septicemia, immunohistochemical diagnosis, septicemia, due to indirect result of trauma, mechanism trauma, lessening of general vitality and resistant invasion of organism. Example, multiple fractures, immobilization, decreased general vitality, cystitis, decubitus ulcer, hypostatic pneumonia, pyelonephritis effect. Pyogenic cocci produce a localized abscess, usually in staphylococcus infection, diffuse spreading cellulitis, usually in a streptococcal infection, bacterial proteus, bacterial pyocines, bacterial E. coli, produce separative lesions association with the pyogenic cocci. Gas gangrene, Clostridium myonecrosis, bacterial infection that produces gas in the tissues, causative organism, Clostridium perfringens most common. Other Clostridium species, Clostridium septicum, Clostridium novae, raminosum. Myonecrosis is caused by a specific endotoxin which destroys muscle tissues and generate a gas at the same time. Composition of gas and nitrogen 74.5%, oxygen 16.5%, hydrogen 5.9%, carbon dioxide for 3.4%. Exotoxin, severe toxemia, death. Postmortem appearances, spleen enlarged, softened, cellulitis, large blister on skin in a gas gangrene, associated signs, blood source, pneumonic consolidations, status. Non-specific toxic signs, congestion of all internal organs, microbial culture under aseptic condition, prevalent of relevant bacteria. Case studies: James Garfield, 20th President of US, was shot on July. He died 80 days later on September because of massive infection. It was produced partially by doctors probing the wound with infected fingers in order to locate the bullet. X-rays were not discovered at that time. American doctors had not accepted the sterilization technique implemented by Joseph Lister during the 1816.